One thing about I'm very passionate about this topic, and the reason I am is because we're all patients. All of us are patients, right? You're a patient, I'm a patient, doctors are patients, payers are patients, we're all patients. And I think the only way to disrupt the nature of healthcare today with a foundation of a future being focused on patient-centered care is through patients that have access to as much data as they can have. And that data right now is not well organized because it's in various places. And it's hard for patients to understand what to do with the data. So these are blockers, right? But at its core, data wants to be free. Okay, so if I pay for something at a grocery store and I get a receipt, I know what I paid for. That doesn't happen in healthcare. In fact, you have no idea what you're going to pay for in healthcare. That's tragic, right? So how do we fix that? Well, first we say expose the data. Make sure the data is available to me. When I go in and I get services done, I want to see a detailed list. In fact, that detailed list, I'd like to be able to shop for that detailed list. Now there's factors in that shopping experience that are subjective, and they're not objective. What do I mean by that? Well, the doctor's quality of delivery services are really important. His demand for his services might be in conflict with a newer doctor where there's less demand. Being aware of availability for patient access to services is something that's new, and it should be more available to us as consumers. It's not. And there's a number of other situations like that. But you can't block the data coming to us, right? Those can't be reasons not to have access to our data. Those are just realities of us now having our data. How do we respond to it? The other thing is, no one could ignore the computational power over the last 30, 40 years. And that's not going to change anything. That's not going to go away. Computational power on understanding what this data means for patients is going to mean our ability to understand the data is going to be quicker, faster, better. And it's going to happen. It's inevitable. So all of the tactics to avoid us not having access to our data, in my opinion, are disingenuous at a minimum, and I think are almost corrupt at a maximum. So even as much as recent events have occurred, where within healthcare, our data is being used without our understanding of what it's being used for. Well, wait a second. We should, know about what our data is being used for, right? But we should also have that very data that's being used. So there's no reason for us not to. And if we don't start, if the consumer advocacy side of patient healthcare doesn't push for these initiatives, I think it's going to be a longer journey for patient-centered care. We shorten the journey by initiatives to provide patients their data. And we have a vision for doing that in our company. We are advocates for the patient in our company, all the while supporting the industry's need to be more efficient. So patient-centered care only happens when patients have their data.